We're going to start with chapter 10, so bear with me. Hopefully we can keep this down. I just want to touch on the highlights that I would have touched up on the slides. We're going to go to slide 4. Actually, slide 5. Here we're talking about the anatomy and physiology of the immune system. These are all important things that you'll need to know forever. So your bone marrow, of course, is very important. And again, let me reiterate that chapter 10, all the first chapters in all these units are like A&P reviews. So hopefully we can get through this chapter just a little bit faster. So your bone marrow, of course, is very important because that's where I make red blood cells and white blood cells. So that is part of my immune system, all right, because my white blood cells are the biggest promoters of immunity in my body. My white blood cells are the ones that go out there and that fight those antigens. And really, really pay attention to the word antigen, all right, because antigen could be an allergen, a pathogen, a bacteria, a virus, all those things. An antigen, and write this down, antigen equals alien, something that is foreign to my body, all right? So antigen, alien, not me, okay? So going on, the thymus gland. The thymus gland is important. It's a lump of lymphoid material that's in your upper part of your mediastinum. It's biggest in childhood, all right, and it starts to shrink as we get older. Now, my thymus is where my T cells go to maturate, and we're going to talk more about B cells and T cells later on. But my T cells are very important in fighting off those antigens, all right, actually huge in fighting them off as well. But we'll get to that later. But I want you to remember that my thymus gets smaller as I age, and that's going to make a lot of sense in those older people and their immune systems. Your lymph system, of course, consists of nodes, vessels, and fluid. The fluid's actually just called lymph. And remember, that fluid is what's left over after all the blood goes through my cardiovascular system. So remember, as my heart pumps, my blood goes from arteries to arterioles over the capillary beds, and that's where the magic happens. The transfer or the picking up of waste to go back to be blown off by the lungs, and the giving off of oxygen that takes place in the capillary beds. So that's where all the magic happens, when it is exchange of wastes and oxygen. And then when that exchange happens, it moves from venules to veins back up to my heart. Now, that's my cardiovascular system, okay? But what's the fluid that's left over that doesn't get reabsorbed in my cardiovascular system at those capillary beds end up being lymph. And lymph has its own system, its own vessels. They're they're very tiny, microscopic. They wouldn't look like big veins. But my body is full of these little vessels that carry this lymph fluid throughout the body. And my lymph nodes, everybody's probably heard of lymph nodes before. Lymph nodes are little pea-sized looking areas all over the place that house some B cells and T cells. And my B cells and T cells wait there until I'm exposed to an antigen. And when that happens, a lot of times I have swelling at the lymph node because everything inside that lymph node is working overtime. My tonsils are just pieces or lymphoid material that's in the back of my throat. There's 3 sets of those. That's about all you need to get from there. Of course, tonsils can backfire on us too, and we can get lots of infections there and have to have them taken out. But for the most part, tonsils are there to protect us from antigens going up into our sinuses or down our throat. Your spleen is a cool little thing. You can live without your spleen, but it does quite a few things. For one, it's a reservoir for extra blood, and it holds quite a bit. I think your book says something like 500 milliliters. But that's quite a bit of blood, and if it happens to rupture, then we can have a lot of bleeding out, and it could be a life-threatening complication. But your spleen also works like a filter. So remember back to A&P when you were talking about red blood cells and how they live for so many days and they die off because my body's continuously making red blood cells. Well, my spleen's job is to take those red blood cells, pull out any iron that they can find in them, and then destroy the rest of it. So the red blood cells don't cause a problem in our body, the old dead ones. Peyer's patches are something you won't hear a lot about. Peyer's patches are in your digestive tract, down in your intestines. And those are pieces of lymphoid material that are designed to keep you safe from ingested antigens. Age-related differences in function are going to be huge in the immune system. We're going to use a few different words, and we'll talk about those in the next chapter, I think. But I definitely want you to remember the word immunocompromised. And those are people whose immune system, for one reason or another, is not functioning at the best capacity. And a lot of these people are just because they're older. And then one of those things is because the thymus gland shrinks, okay, during as we get older. As we get older, our bone marrow turns to fatty material, so we're not making a lot of good white cells there. There's so many things that happen to us in older age. Our skin gets thinner, and our skin is a huge shield for us. So if our skin is thin, then it's able to be broken down, and we don't have that good shield anymore. But we'll keep talking about age-related problems as we go through the slides, because there are tons of them. The next slide is slide 6, organs of the immune system. It just gives you a good little idea of where those things are. Notice the lymph nodes. They look like little pea-sized areas going along the lymph vessels. And kind of notice where everything else is. All right, all those things we just talked about. Next slide is protective mechanisms of the immune and lymphatic system. Inflammatory response is my second line of protection. My first line of protection being my skin and normal flora. All right. And we're going to talk about normal flora quite a bit. Normal flora is my own bacteria that lay on my skin and in my mucous membranes. They're mine. And when I'm healthy, they do me good. All right, they help to protect me. And we're going to talk about ways that my normal flora can backfire on me later on. But as of right now, the skin and the normal flora are my first line of defense. They're my shield. If that shield is broken for any reason, then my inflammatory response is the second line. And we'll talk more about the inflammatory response here in just a little while. But think about any time that and I always use stepping on a splinter. I always do that. So think about when you have stepped on a splinter and how it gets angry and red and swollen and it hurts and there might be pus coming from it. That's all a localized reaction. It's just happening at that one spot. So that is a big reason why the inflammatory response is important. It keeps that bacteria localized to just that one area. Now, sometimes our bodies can't do that very well, and our immune system has to take over. So that's our next line of defense. This slide talks about types of immunity, primary humoral response and secondary cellular response. We get into those quite heavily here in just a little while. So we'll skip that for now. But for primary humoral response, I want you to write down in your notes that primary humoral response equals B cells or B lymphocytes, and secondary cellular response equals T cells or T lymphocytes. And then we'll touch on those again later. Immunity against disease, I always want you to remember innate immunity, and we're going to get heavily into the immunities here in just a little while. But innate immunity is a natural immunity. It's something that I'm born with. I did not get it from getting a disease. I did not get it from anybody else. I was born with it. It was my God-given right. So that's what makes humans not susceptible to a lot of diseases that animals have. Some of them we are, as you can see, of COVID-19. Those are one of those that we think we got from animals. Actually, I think we know that. But in most situations, I'm immune to a lot of things, and I just have that by being human. Let me scan through here and see. All right, for acquired immunities, everything else is an acquired immunity. And I do believe you've got a box somewhere in here about those immunities. And I don't see it right off the bat. Maybe it's in next chapter. But I definitely want you to go back and think about all those immunities that you get throughout your life. All right. So you've got the natural. I wish I could find that box for you. It's somewhere here. You've got acquired immunities that you get passive natural, is when you get antibodies from your mother's milk or the placenta. So natural passive, all right? I didn't actively get a disease, but I got the antibodies from my mother, and it was a natural way that I got them. So natural passive is getting antibodies from mother's milk or placenta. Natural active is when I actually, artificial, I'm so backwards right now. Active acquired is when I actively get the antigen exposed to me. So let's say I got chicken pox and now I've got immunity to it. So I actively got that bacterium. Let's see, artificial passive is when I cannot make my own antibodies and I have to have an injection or infusion of someone else's in the form of immunoglobulins. And then active artificial would be if I got a vaccination. All right, so let's run those down again because I think I might have got everything backwards. Okay, so, excuse me. So for passive natural, okay, write this down with me because this is straight because I just made notes. So passive natural is where I naturally get it from my mother, all right? I didn't actively get a disease, but my mother gave me immunoglobulins, antibodies, same thing. She gave them to me via the placenta or breast milk, okay? Active natural is that I got the disease. I actively got it, and I got it naturally. Someone did not give it to me in a syringe, okay? So active natural is I got the disease. I got the chicken pox. I had the illness. All right. Active artificial would be that I got a vaccination. I artificially got it injected into my arm. I didn't acquire the disease myself. So active artificial would be a vaccination. Passive artificial is I cannot make my own antibodies for whatever reason. I'm immunocompromised. I can't make my own. So I have to get them via an IV infusion, someone else's antibodies in the form of immunoglobulins. And that would be passive artificial, okay? You will see that probably on your test in some form or fashion. Next slide is looking at action of the immune response against foreign invaders. It's a good little thing. I believe it's in your book as well. Let's see here. Yeah, on page 201, you have this in your book. Just something to look over a little bit. We won't go into depth on it, but just look over it. Next slide is the humoral antibody-mediated immunity slide. It's where you have a nice little picture of what happens when your B cells kick into gear. Now, let's touch on our B cells or our humoral immunity right now, okay? So, my humoral immunity, when my body recognizes that there's an invader or an antigen loose in the system, what happens first is my humoral immunity. It's my first line of immunity, okay? It is what involves my B lymphocytes or B cells. Now, my B cells are cool little things. They are made in my bone marrow, and at that point, we're calling them stem cells. And with the help of chemical mediators, they are released out to my system, and they migrate out to my lymph system to lay in wait. And when that happens, they have actually grown into inactive B cells, okay? So they're completely inactive the whole time they're waiting for an antigen to be released, all right? They're just laying there on high alert until something breaks the system and I have an antigen loose in my body, okay? At that point, when my B cells come in contact with an antigen, then they turn into active B cells. Now, let's stop there and talk about how in the world would my body know that it was an antigen? Well, our bodies are cool things. So, in the next chapter, we're going to talk quite a bit about allergies, and this might make more sense. But when my B cells are made, they look very different than each other. All right, I have B cells that my body makes that might have antibodies against chicken pox. I have B cells in my body that come out with antibodies on their surface that would fight against hepatitis B. And those are all made because at some point in my life I had been subjected to them and my body knew to make antibodies for them for the rest of my life. Pretty cool, right? So when my B cells are made, they're very specific and they carry an antibody to fight very specific antigens, okay? So if that antigen is ever in my body again, those very specific B cells with those antibodies on the surface would remember it. Hey, I've seen this guy before. I'm carrying the antibody on my surface that is to fight that antigen, so I'm going to attach to it and in some way, form, or fashion render it inactive. All right, super cool. All right, but my body would have to have been exposed to it at first. Okay, so in the very beginning, when my body's exposed to something, let's talk about anything, then I have a response and my body starts saying, oh, well, here's a new antigen and I'm going to figure out ways to make antibodies to it. And that is with my B cells splitting off and making a couple of other cells. Plasma cells, which secrete massive amounts of antibodies, and memory cells, which are those that will go lay in wait and remember that I've seen this antigen before. So that's very important to remember about B cells as well, is that my plasma cells are the ones that come from my B cells that make all the antibodies, and my memory cells are the ones that will remember for future use if I'm ever exposed to that antigen again. So we'll say, for me, in this slide, that this is a microbe or, let's say, chicken pox. I've been exposed to chicken pox again. And that I've already been exposed to chicken pox once before in my life, so my body knew to make B cells that had the antibody. An antibody is what's fighting antigen, but my body had known that I'm going to make cells that would have the antibody for chicken pox on them again. So what happens is those inactive B cells, when they come in contact with that chicken pox antigen, then there's a number of things that happen. And you can see at the top it says the foreign microbe with the antigens come in contact with the macrophages. And think back to AMP. Macrophages are notorious for being phagocytotic. And that means that they grab a hold of a antigen or a bacteria, they engulf it, they digest it, and then there we go. All right. So we're seeing that here. Now, I always want you to piece macrophages with phagocytosis. So in this picture, we see that this foreign molecule of the antigen is being engulfed by the macrophage. And then it says the macrophage ingests the antigen, and then the macrophage processes the antigen. And when that happens, the macrophage presents the antigens to the B cells and the T helper cells. Now, we've not talked about the T cells yet, but I want you to jot down that T helper cells are the big stimuli for B cells to work. They're kind of like, hey, I've got your back, let's do this. And when my B cells are stimulated and those helper Ts are stimulated, then I've got a big process going on. All right, my B cells begin to work, but the T cells are their cheerleader behind them saying, come on, come on, come on. We've got to keep going. There's a invader on the loose, okay? Now, when that B cell is activated, then it's going to, and you can look off up to the side, it says subsequent exposure to the same antigen changes memory B cells into plasma cells. So I had been exposed to chickenpox before, so I had those memory B cells from subsequent or from previous exposure to chickenpox. So when that happens, those cells go off and they make tons of plasma cells. And the plasma cells are the ones that secrete large amount of antibodies. So that memory B that remembers, hey, I've seen it before, I've already got the antibody, it's going to start making more plasma cells to make even more antibodies to fight off the chickenpox that I've been introduced to for the second time, okay? And that memory B cell will always remember that antigen. Also, my B cells, it says, duplicates into two clones, the memory Bs and the plasma cells. So I'm going to make more memory Bs, and of course I'm going to make those plasma cells we just talked about. Those plasma cells are the ones that make those ginormous amount of antibodies to go fight the current antigen that I'm fighting, all right? And then at the bottom you see the antibodies inactivate the antigens, okay? So in a nutshell, what I've got is B cells and helper Ts. Actually, we're going to say right now my B cells or what happens when my macrophages say, hey, I've ingested an antigen, here it is. My B cells kick into high gear. It pulls out any memory Bs that have seen this antigen before, and then my B cells go ahead and they make more memory Bs, and they make those lots and lots of plasma cells that are going to excrete tons of antibodies that will render that antigen inactive. And that is my first immune response, okay? That's what happens immediately. My next slide is cell-mediated immunity, and this is what involves my T lymphocytes, or my T cells. Now, my T cells are a little bit different, and the T stands for thymus, and that is where they maturate. They mature is in the the thymus, okay? And then after they mature in the thymus, they go out and they're roaming around somewhere in the lymph system, waiting for things to happen. But this response takes just a little bit longer. And we can see at the top of this slide, it says the foreign microbe with the antigens introduced to the macrophage. And we know that macrophage is the guy that's going to come in and engulf it and try to ingest it. And when it's processing, it goes over to the T cells a little bit later. Remember, at the B cell is our first response. But then it'll find the T cells. It'll find the T cells, and it activates 4 different kinds of T cells. And these are pretty important to remember. My killer T cells just go out there. They're my natural samurais, okay? They go out, and this is the clone of the T cell that will go out and actually find the antigen and kill it on sight. And it has to be specific to the antigen it's looking for, okay? It just won't kill anything. If these killer T's went out and killed anything, it would be very harmful for my body, okay? That does happen to some people, but we'll talk about that later. My helper T's, of course, we talked about those last slide. The biggest thing I want you to remember there is it helps to stimulate those B cells to work. It does stimulate other T cells to work too, but it's all in the name. These guys are just like the cheerleaders. They keep pushing the other cells forward to work. My suppressor T's are the ones that stop T cells and B cells from working, so I don't have an over-exaggeration of my immune response, okay? And we'll talk about that again later. If I did not have suppressor T's, then I would have allergic reactions to many different things. So people who have allergies, they have an over-exaggerated response to certain items. So let's say I was allergic to peanuts and I ingested a peanut and I started to go into anaphylaxis and my airway was swelling. That would be a way over-exaggeration of my immune response. So my suppressor T's are there to keep that from happening. And of course, my memory T's are designed to remember those antigens for future encounters, much like my memory B cells. All right, they just work in a little bit different way. That's about all you need for cell-mediated immunity right now. The next slide talks about types of immunity. This is the one that we were talking about earlier. I didn't even know this slide was in here. I forgot. We'll go through it again. Immunity at the top, genetic or inborn immunity. That's another name for innate immunity. I have innate immunity just because I'm human. And then we've got acquired immunities, and every other immunity that we have are acquired. I get them later in life. I'm not born with them. So my naturally acquired immunities, of course, are the active kind, active natural. I actually get the disease. So I got chickenpox as a child, so now I have immunity. Passive natural is getting the mother's antibodies through breast milk or the placenta. And then we've got active artificial, which means that I did not get the disease, but I got the vaccine to it. And then we've got passive artificial, which means I can't make my own antibodies. Doesn't matter if I got the disease. It doesn't matter if I got the vaccination. It wouldn't work. I can't make my own. So I'd have to receive an infusion of somebody else's antibodies in the form of immunoglobulins. Next slide is immune and lymphatic system disorders. Iatrogenic immune alteration. Iatrogenic means that a medication or some sort of medical treatment has caused an alteration in my immune response. All right, so I think a good representation of that is chemotherapy. Chemotherapy is designed to kill bad cells, but it knocks our immune system down so drastically that we're prone to lots and lots of infections. There's lots of physiological changes with aging in your immune system. So make sure you're reading those in the book. So we've got thinner skin. We've got reduced ciliary action. So all those little hairs in our lungs that normally help us get up impurities that we inhale, those little hairs are not working to push those things out anymore. My older adults can't cough very well because of the weakening muscles in their chest wall. Every time we take a breath, we have a slight expansion of our rib cage. And when we get older, we don't have that expansion of rib cage, so we don't get good deep breaths anymore. Our thymus has shrank, so we don't have good maturation of T cells. Our bone marrow is not working like it used to. A lot of that marrow is now replaced with fatty tissue. Lots of things happen in aging that really kind of knock us down. Alcohol is something to throw in there. Alcohol does reduce your immune system. And autoimmune disorders is which we're going to really talk about next chapter. Autoimmune means that my body is attacking its own cells. Okay? So normally when I'm introduced with an antigen, my body will go in and fight that antigen. But people with autoimmune disorders, their body actually fights their own cells. Maintaining a healthy immune system, this of course is a no-brainer. Eat right, get enough rest, and exercising. So if you want your body to function correctly, then you have to take care of your body. So those things listed below, skipping meals, eating unhealthy meals, sleeping too little, not exercising, those all weaken your immune system and make you more susceptible to getting illnesses. So that's definitely going to be a part of your teaching when you do education with people who have weakened immune systems. Some ways that they, look at this hair, guys, some ways that they can strengthen their immune system. Eat healthy, good protein, make sure they're exercising. I'm not saying get out there and run 1,000 miles, but, low impact. And make sure that they're getting enough sleep. Very important. Your body has to recharge. An immunization or a vaccination, these are ways that I can ingest usually a dead form of a virus via syringe. And that way your body can make those memory cells. And if you're ever exposed to it out in the public, then you'll have those antibodies to fight that specific antigen. Vaccinations are quite important. A lot of people cannot fight off the actual bacteria themselves. And then, as you can see with COVID-19, when things become widespread and pandemic like this, they're hard to control. So immunizations are quite important. Now, there's some people that I wouldn't want to have immunizations. People who are immunocompromised. Now, I'm not saying people who have chronic illnesses or people who are pregnant. Most pregnant women can have some of their vaccines. And people who have chronic conditions should get vaccinations, so we don't want them to get sicker with something else. When I'm saying immunocompromised, people who cannot make their own antibodies should not get vaccinations. So if I've had to give you immunoglobulins in the last couple of weeks, then I know that you're probably immunocompromised. You couldn't make antibodies before. So I wouldn't want you to do that. And I also wouldn't want to give you one if you're already fighting a viral or bacterial illness. And that's much like sending all of your protective cells out to the front lines. You're already fighting an illness. And so there's not really a lot of guys left at the castle to be able to protect the castle. So if someone's running a fever, then I know they're probably fighting some sort of illness, and I wouldn't want them to have a vaccination. Also, some religious and cultural practices forbid it, and I think one of those are Jehovah's Witness. Other than that, I think we should be good, but you do have a lot of people that say it's against my religious belief to have vaccinations. You also see some people who are anti-vaxxers that say the same thing, but, if they say it's against their beliefs, then it's against their beliefs. All right, next slide. This is a good little chart to show you the comparison of primary and secondary or immune response. So this is about a vaccination. So it shows here that the first time I get a vaccination, it's much like the first time I'm exposed to an antigen. I don't have a lot of good antibody response because I don't have a lot of antibodies made. The first time when I have that vaccination, if it's the first time I've ever been exposed to that antigen, then my body has to do that process of making the antigen. Making the antibody. So I don't have a lot to help me the first time, but with it being a dead virus, I should only feel slightly sick. I might get a slight fever. Remember, my body's having to work to make antibodies, so I will not feel wonderful after a vaccination. I shouldn't get sick with whatever that vaccination is protecting me against, but I will not feel great. Excuse me, I'm so sorry. But I do have a little bit of help there. But my body in that first time is trying to make the antibodies, so I don't have a big response. Now look at the second time. So we'll say this is the chickenpox vaccination again. The second time I'm exposed to the antigen of chickenpox, look at all that big response I have from my antibodies. They've seen it before, so they know, I've seen it. Let's go in and let's go fight it. All right, so fantastic slide. Skin testing. This is just talking a little bit about a couple different ways that we can do skin tests or intradermals to test for certain infectious diseases. This is all you really need to know for this. The stick test for diphtheria. You don't see diphtheria a whole lot anymore because we vaccinate against it. And the tuberculin skin test or the mannitol test for tuberculosis. And people are doing those a little bit different nowadays. Used to, you got one a year. Some people are doing them a series of 2 over the span of a few weeks. And then some people are doing that and then not testing you again until if you ever come in contact with TB. So that really depends on who you go to work for. But the TB skin test is cool because I'll actually put a little bit of what would alert my body to that antigen being there and see how it reacts at that spot. And that lets me know if I have antibodies set up to tuberculosis. Now, if it gets swollen, that means my body's made antibodies before, and that means that I have been subjected to tuberculosis, okay? And that's how we know. So if you have a positive skin test, then you have to go get another series of tests like chest x-rays and other blood work to determine if you're actually carrying the live virus. If I have a positive skin test, again, that just means that I've made those antibodies. I've been exposed to the TB before. Skin testing, this one's for allergies. There's several types. It says a scratch test, also called a prick test, is the most common way to get tested for allergies. And your allergen doctor or your nurse, whoever it's going to be to do the test, will have some little plastic cards about this big that all have tons of little pricks on them, little tiny plastic things that will actually scratch your skin. And they'll have cards that equal maybe around 35 or 40. I think it may depend. But lots and lots of little allergens they're going to expose you to. And what they do is they'll turn that card over, and with each little thing that was going to prick you, they're going to put a different allergen. Okay, and they're going to put a drop on it, and they're going to turn it over on your back, and they're going to dig it in a little bit and cause a little bit of a scratch so it's underneath your skin. And that way, it's kind of working like the TB skin test. If I have a raised area or swollen area, that means that I have formed antibodies to that specific allergen, and I'm going to know that I'm allergic to it. Okay, and that's how they're going to test it, to see if my body's built up a bunch of immunity against that specific thing. When it comes to allergens, then I have lots of different levels of allergic responses. I could just get itchy at the site, all the way up to my throat or my airway closing. But I'm going to figure that out with a scratch test. Intradermal injections of allergens, of course, that's what we just talked about. They do a patch test as well, and I think they do that on the inside of your arm. But we'll talk about that next slides or next chapter. And then, of course, it again says inflammation, itching identifies the allergens. Lab tests. There's some great lab tests to do to see how my immune system's... Oh, goodness. How my immune system is working. My complete blood count is very important because if I order a CBC, what it's going to say to me is it's going to give me a very generalized number of a white blood cell count. And for most labs, the normal white blood count is 5 to 10,000. Okay? Woo! Goodness. 5 to 10,000. So I know if it's above 10,000, then my body's fighting off some sort of infection or antigen. If it's below 5,000, I worry because then I don't have enough white cells to fight if I do encounter an antigen. All right? So I'm worried if it's out of whack either way. Okay? But my CBC is just going to give me a broad 5 to 10,000 is the normal. It's going to give you that number for my white blood count. If I wanted to see all those different white cells, such as my lymphocytes, my eosinophils, my basophils, all those different white cells you learned about in A&P, if I wanted to see those individually, then I would need to order something called a differential. So I'd order a CBC with diff. And a differential can be manual or it can be automated. And all that means is if I order an automated differential, the machine that they put it through determines the amount. If I order manual, then I've got somebody looking under a microscope and they're going to tell me the amount of cells that they see per 1 drop of blood. So, but that gives me a good idea of what's really going on. If I'm looking at a white cell count and it's elevated, of course I know something's wrong. But if I look at the individual white cells, it might give me a better indicator of exactly what that is. For instance, if I saw a high level of basophils, then I would know that it's probably an allergen. Okay, I'm having an allergic reaction, and that's why my white count's up. If I saw eosinophils, it could be some kind of parasitic problem. So it's important for me to look at that, or at least for the doctor to as well, those individual white cells. So in most situations, if you think someone's ill, you are ordering a CBC with differential of some sort. Okay, of course, but that'll be up to your doctor. And of course, you can do blood testing to determine if antibodies to a disease or condition are present. So there's other blood tests that we can do, but the biggest one that I want you to focus on right now is the CBC. Imaging studies, the immunoscintigraphy, it's a nuclear medicine, and what that does, it kind of sticks to antibodies. They'll inject a radioactive isotope into your bloodstream, and what happens there is it lets them know where there's clumping of antibodies. And when they see that clumping, if they saw a large clump of antibodies sticking to a mass in my chest, it might signify to them that those antibodies are trying to attack a tumor, so, or something along those lines. So if they see clumping of antibodies in the system, then they may be able to tell where the problem is. And that's about all you really need to know for this slide. Okay, the CTs, the MRIs, and the PET scans, they're always important to know. CT scans, MRI is usually pretty much better than a CT scan. We'll start with the CAT scan, though, a CT scan. All these tests help me to see the insides of tissues and organs, so like in slices, okay? If I had an x-ray, I can see anatomy, okay, but I can't see inside of any kind of organ. But I can with CAT scans and MRIs. Now, CAT scans I can either do with or without contrast. Very important that you remember if it's with contrast, these people will be in PO. And I really have a lot of people out there who are allergic to that CAT scan dye. So I have to ask that too. And I also want you to put in your memory, it's very important, people who take metformin also have high problems with their kidneys and the dye. They can actually cause me to have kidney damage. So people who are on metformin for diabetes should be off that medication before and after the CAT scan for some time. Okay, and the doctor determines that. I think it's 24 hours before and maybe 3 days after. I'm not for sure. But I definitely want to be making sure I'm looking at their list. Okay, so if I had a CAT scan and I was able to use the dye, then the dye just helps me figure out as it's going through my bloodstream places that I might have abnormalities. The MRI is magnetic. What's important about an MRI is to make sure that your patient has on no metal, or that you're asking about metal that might be inside their body, because it is a big magnet, okay? Some metal can go through an MRI, like titanium, and some can't. So definitely asking about pacemakers and defibrillators and pieces of their body that may be in there that are metal. And then the PET scan. The PET scan is a really, really awesome in-depth scan that we use a lot of times looking for tumors at the inside of tumors. But we can use all of these tests at our advantage, all right? So the most common probably being the CAT scan and MRI next. All right, planning for your patient who with immune problems. We definitely want to protect them from infection. So talking about a patient who is immunocompromised, let's say that you have a patient whose white blood cell count is below 5,000, okay? These people don't have any white blood cells to help them fight off anything, so they may be in the hospital to protect themselves, okay? And that's strange because we would call that reverse isolation or protective isolation. So sorry. So we're protecting them from the outside world. So we want to make sure that we're wearing our PPE before we go in, okay? If we definitely don't want to go in if we're sick. I would never go to work like this and take care of anybody. Goodness, who has a low white count. So, and I also should be worried about taking care of other people that have communicable diseases when I'm also taking care of this person. Goodness. So the person who makes the assignments for your shift that day should not be giving you a patient who is immunocompromised with a low white count with, say, someone else who has, MRSA or TB or something, if that can all be possible. But make sure that you're protecting your patient. So they should not have any fresh flowers in the room, no fresh fruits or vegetables. They should always have cooked foods. Make sure that their room is safe because we don't want them to fall because they have a low immune system. We can end up with an infection. We just have to protect them in any way we can possibly think of to keep them infection away from them. Improving health status goes back to eating a healthy food. For low immune people, cooked food too. Making sure they're getting exercise, they're hydrated, and they're sleeping well. Implementation of these goals, this planning is to make sure that you adhere to standard precautions. This would be for people who are going home as well, if they have immune system problems, or if they're sick and someone else in the house has to make sure that they don't get sick. Teaching about standard precautions and hand hygiene. Protective isolation is what we talked about last slide. Protective isolation are for those people who we're trying to protect from the outside world, those people whose white counts are very low, and make sure that we're promoting that balanced, adequate nutrition. And that could be teaching the family as well. Evaluation. Evaluating as always, did we meet, are the expected outcomes here? Did we meet our goals? And for this, what we would want to make sure that we understood is, how would we check that? How would we make sure that someone is infection-free? So I definitely might do blood tests to check their CBC and their white count. That's an absolute. I would make sure that they're not running temperatures, and I would teach them how to go home and take their temperature daily. I gather follow-up data, their vital signs, those lab tests again, and evaluate the effectiveness of nursing and medical interventions. And that, again, if I see that their white count is stabilized, their vital signs are stable, they have no outward signs or inward signs of infection, then I know that I've met my goal. Common problems related to the immune and lymphatic system, fever. Anytime usually when we have a bacteria involved or something along those lines, or a lot of viruses as well, then we'll see a fever. And I want you to remember that a fever is your body's natural protective mechanism as well. So we don't want to get rid of a fever when it first starts in most situations. So a lot of my patients I will let run like 100.5 temperature before I medicate them. And that will be laid forth by your facility and your doctor. So you'll have orders that say medicate temperature above 100.5 or 100.7 or whatever it may be. Because a little bit of fever helps us to get rid of whatever the antigen is in the body. Another common problem we see with people with low immune systems or who have an attack on the immune system is malnutrition because they lose the desire to eat. So we have to make sure that and we can't get better if we're not eating. So you have to make sure that these people are eating. And this could be where they get some kind of supplement as well. And immunosuppression. So it's funny too because there's a couple of ways I can look at immunosuppression. If I am sick, like I am right now, and I got diagnosed with bronchitis and a sinus infection, I'm on antibiotics, which will go in and will help the bacteria. But when I'm on an antibiotic, I'm also low immune system. The antibiotics typically cause my immune system to go low. A lot of people who have lung infections get put on steroids, and steroids knock your immune system out. So while you're sick trying to get better, your immune system's actually lower. Now, there are some times that I want your immune system to be suppressed, and that will be in instances where I've had things like an organ transplant. Okay, so remember, anything that is foreign to my body tries to fight off. Okay, and if I got an organ transplant, that's not my organ, and my body tries to fight it off because it's alien. So I need to give these people medicines that suppress their immune system so they don't kill that organ that they just got. But then, of course, that makes all their immune system suppressed. So those people are high risk of getting very ill as well. Okay? So that's chapter 10 in a nutshell. Those are the most important aspects of the chapter. Make sure you read the chapter thoroughly. Okay? And we can keep talking about this all the way through the week. We'll meet again at 2 o'clock to see if you had any questions about this chapter, this chapter specifically. And I'll work on the next chapter. See you soon.